Can you talk a little bit about how incorporating the psychological factors into the rehab process doesn't necessarily have to be this thing that's explicit to the athlete?
Yeah, and I think that some athletes need very little of it. I think that in the beginning you get a sense, yes, I do think that there's merit to using what I've been comfortable using thus far as outcome measures have been the ACL RSI, the Return to Sport Index, and the Tampa Kinesiophobia Scale. And those are just I have found very little skepticism with making sure that those are just part of like the normal intake packet that they have to fill out when, for their initial eval with insurance stuff and all that. And it seems to make it, if you present it then, it's kind of a little bit more routine. It's not necessarily like, okay, why does she want to know about my confidence with loading my knee and things like that. So yes, I do think that those are important, but I think that what makes it most useful, and I even hesitate to say it as far as a treatment thing or tool, because it's really not that. Just like you said, pain science isn't like a modality really. It's the clinician having some background knowledge of that concept and then being able to navigate where it might be snagging or hindering progress. So, for example, I'm not necessarily going to have a psychological conversation with the person day one. As we start to do things, as a clinician at this point, you can really tell how confident they are with, what's the word? Completing a task that you give them, even if it's something like a terminal knee extension with a band or walking normal. If they're really struggling with just getting back like a normal gait pattern, maybe we dive into that a little bit more. Like, hey, what do you think's limiting you? And really being curious and asking questions is a super helpful actual tool to be able to direct you the right way as far as education, promoting self-efficacy, confidence, all those kinds of things for that specific person. I know that's not a super concrete answer, but I think that if I were to guess and or give a picture of how I sort of use it, implement it, it's that. It's both via my eyes, kind of seeing, okay, this person clearly is not comfortable with bearing weight on a bent knee in this particular pattern. So I'm going to switch it up. If they're still not, if that seems to be consistent, then I might dive into that a little bit more. The bigger thing becomes when you're talking about stepping foot back on the court or the field. And at that point, if there are some large enough reservations in their own head, they'll come out verbally then, most often, because then it's like almost if they're truly not confident from within, but they are very well off physically, like that's when you can probably start to ask, like, hey, do you feel ready? Do you, and that's an appropriate time, I think, to ask. It's not necessarily 3 months post-op when they're working on loading goblet squats or something like that you're like, hey, do you feel ready to go back to sport? Like that, it's not, it's definitely a progression. But I hope that makes sense.